Hello, everybody. Thank you for joining today. We will see some main functionalities of our platform. It's my pleasure to welcome you, Sagar and Thomas, our medical students. Okay, I'm Daniel, co-founder of Medicteit. So what is Medicteit? Medicteit is an AI educational platform for students, and today we will show you one interesting case of one patient from a neurology domain. Hopefully, yeah? Okay, Sagar, so it's your turn.
Perfect, thank you. Thank you. Hi, everyone. My name is Sagar. I'm a final year medical student at the first faculty of medicine, Charles University in Prague.
And hi, everyone. My name is Thomas. I'm a fifth year medical student at the first faculty of medicine here in Prague. And we want to welcome you to our demo of Medicteit, this really cool platform that we're using and working with for the last couple of months.
Okay. And so here we are excited to show you what Medicteit is all about, why it's interesting for medical students and healthcare professionals. So Tom, what did you find very interesting about this platform and what got you hooked on to this?
So it's funny you say this because it was you that introduced me to this platform. And when you introduced it to me a couple of months ago, I believe, I was using this for many things, but what really was the fact that I could apply my theoretical clinical setting and be able to make mistakes. Because when I'm in the clinic or in the ward with the doctor, there's some pressure. I have to perform at my best, and I don't want to make a mistake in front of the doctor. But that can impact my learning. So when I'm able to make mistakes and receive very structured, I feel more confident in my abilities, and I can apply that in the real setting when I go into the ward the following day.
Yeah.
So what got you onto the platform?
So what is really interesting is that I'm right now doing my internal medicine rotations. And I really wanted an opportunity to practice all the high amount of knowledge, all the voluminous knowledge, and to put it into use, to have enough time and to be in a safe space where I can make mistakes. So Medicteit offers a lot of real-life cases and virtual cases, which allows us to think, how should we approach the patient? What kind of questions should we ask? Are we making a mistake by asking different kinds of questions? What kind of diagnostics should I be interested in? How do I navigate to the vast array of treatment options? And how do I choose what to say to the patient? So to develop this streamlined method, to develop this rigorous training in having a fluent flow of approaching a patient and asking them the right questions, making them feel comfortable, talking about the diagnostics, and doing all of this while making the patient feel comfortable is an as medical students and recent graduates. This platform allows us to practice this as much as we want, as many times as we want, within our own safe space, be it in the night when we are really tired and after a long day of studying, or even when we are preparing for exams and we want to be able to recollect all the signs and symptoms that a patient might have for different diseases. So,
okay. Great, guys. So let's dive into our case, right?
Perfect.
So I'm sharing our platform just now. And please, if anybody of our audience has got some questions, please send questions through the messaging system. Here we offer the platform. So let's start the first case, please.
So what we have is we're going to be showing you all the features of Medicteit, all the features of the virtual case page as well. So let's decide, I think cardiology is probably also something that's very interesting.
I think one of the really cool things that we want to talk about is that the virtual patient feature. And when we pick a virtual patient, we can choose the specialization, the patient, and the language. So if you're studying endocrine, if you're studying cardio, if you're studying pneumology, you can choose the type of patient you want to practice on. But if you want a real challenge, you can surprise yourself and go random and test your knowledge.
Yeah.
So you go ahead.
So we are interested in showing you all the features of Medicteit. So we have a nice case. I think we can go for cardiology.
Yeah.
So let's see, we can go for this patient, for example, and let's just choose the easy mode to showcase what features we have to offer. So over here, what we can see is a brief review of the patient history, right? And here we also have an understanding of a basic understanding of the patient. Here we have a button that can help us do the physical examinations and also order some tests. So let's get started. So Tom, how would you start talking to a patient?
Okay, so I think as any good doctor or any clinician, we should introduce ourselves and make the patient feel comfortable and maybe ask the reason for the patient's visit. So we can start the microphone and we can talk to the patient using natural language.
And just also a very, very interesting feature, let's say in a very busy environment and you don't, or maybe you don't have the energy because you're so tired of having a long day of studying, you can also make use of the chat option where you can just type your messages. So in this way, you can still talk to the patient. Right now, we would like to showcase the microphone feature where you can actually talk to the AI. So let's get started. So Tom, go ahead.
Okay. Good evening, Mr. Vesper. I'm the doctor on the ward today. How are you doing? What brings you to the clinic?
Okay, we are waiting for the response.
Maybe a quick.
Yeah, okay. Problem. Something with our network is happening, but let's repeat it, right?
Yeah.
Okay. Thomas, please.
Good evening, Mr. Vesper. I'm the doctor on the ward today. What brings you to the clinic?
Good evening, doctor. It feels like my heart sometimes skips or slows down, and I get lightheaded. I'm honestly scared it might just stop while I'm walking or teaching.
So here we can see that the patient is also able to speak to us and we're able to understand how the patient feels and we're able to sort of imagine. So what Medicteit does is it gives us an opportunity to imagine the patient and then to ask questions. So Thomas, he says that he's having, he feels like his heart is sometimes skipping or even slows down. So what would you do in the situation? What would your next question be?
Yeah, so that's a good point. So the patient is telling us that he's feeling some problems in his chest, in the heart, and he's feeling some lightheadedness. So I think it's important now that we ask some further questions about these symptoms and maybe understand when it began or what caused it, or did it come suddenly. So I think we should question the patient a little bit more to find some more information.
Yeah, I agree. And I think we should also make sure that he's not having any impending hemodynamic instability. Yeah. So let's just ask if he's feeling dizzy or if he feels like he's about to faint. Yeah. Thank you for the information, Mr. Vesper. How do you feel right now? Do you feel like you are about to faint, or do you feel like you're having some palpitations?
Right now, I feel a bit dizzy, just sitting here. And my heart feels.
Okay. Yeah, and my heart feels literally slow. Okay, so
and he's saying that it's barely beating, and he's not exactly feeling palpitations, but just a lot of anxiety. So I think what's important right now is to immediately check if he's what his ECG shows. Because if he's about to go into any hemodynamic instability, then we should make immediate intervention.
Yeah.
So let's go ahead.
So yeah, I think that's a really good point. So based on what he's saying, an ECG would be a very good option right now. So should we order the test for an ECG?
How about we ask him when did it start, and then maybe we can do that.
Yeah.
So get a better understanding.
That's a good idea.
Okay, I see. And when did this problem start exactly? Okay, so he's saying
Happening for about 6 months, I think. At first, I just thought I was tired from work, but these last 2 weeks have been much worse. I almost passed out walking up the hill to school.
Okay, then maybe we should ask if he already did visit an emergency or if he spoke to any doctor. Okay, I see. And did you visit a doctor for this, or did you visit an emergency department for this?
I went to see my GP back in Olomouc a few days ago because I couldn't ignore the dizziness anymore. He did that heart tracing thing, the ECG, and told me there was something wrong with the rhythm, so he sent me straight here.
Okay, so let's just see. Recent ECG showed second-degree AV block, so morbids. So let's then do, and we can order some tests. So
I think let's order the ECG and then we can ask some further questions, some related symptoms to get a better picture.
okay.
So yeah.
So a 12-lead ECG. So for our viewers, this is the diagnostic library, and this is what you would typically see, right? And what we are interested in is in some cardiac diagnostics. So we have the 12-lead ECG over here. We select this, and we can also do an echo. So let's just have a look. Auto selected diagnostics, and we get our results here. So let's look at this. Okay, so he's having bradycardia, but we can also see in the findings that he's having intermittent non-conducted P waves. So I'm guessing that this could be Morbid's type 2.
Type 2, yeah.
Yeah. And we also have a picture of the ECG over here.
Yeah.
But of course, this is also the beta version. So we are improving our diagnostic library where we are also including ECGs. So now let's look at the transthoracic echo as well.
Yeah.
So we can see that the left ventricular ejection fraction is decreased. It's 45%, right? So this is quite low. So now, Tom, what are you thinking of? What do we do with this information?
So with this information, we can think about some possibilities here. We can't make a definite diagnosis just yet, but we can think about some kind of arrhythmia, some kind of maybe some heart failure could be there. Some kind of coronary heart disease could be a possibility. Or it could also be something in the lungs. It could be some kind of lung problems that are manifesting in the heart as some kind of buildup or some congestion.
Okay. That's interesting.
Yeah.
So then in this case, what we would now do is we will just ask him a couple of questions and also do a physical examination to see if he is in fact showing signs of cardiac failure.
Yeah.
And then we can order some tests like an X-ray to see if there's any congestion in the lungs, right?
By the way, guys, I've seen that there's some kind of ultrasound. Is it now interesting for you or not?
Yes. Well, of course, it is. It requires a bit more nuanced understanding of the echo. But what is interesting is that as we are developing a library of the echocardiograms, we are now more and more seeing, I think there's some hyper echoic areas over here. So I think it needs, as medical students, we try to explain, we try to see what could go wrong. And that's what I would say.
Maybe this one is already for residents, right?
Probably, I think this would be for...
Okay.
I think it's really good that you mentioned this because even for the less experienced medical students, when we order a test, the Medicteit platform also gives us the explanation of the findings. So even if we cannot fully interpret the image, it shows us that the left ventricular ejection fraction is slightly low. And it also tells us the interpretation of the ECG. Because some students may find this a bit difficult to interpret, we can directly look at the results with the reference ranges, which I think is really good. Yeah.
So now let's we'll ask him, what do you think we can ask him? What do you think would be the signs of heart failure?
We can ask him about some, if he's having any shortness of breath, any kind of radiating chest pains, or any signs of edema maybe during a physical examination. We can have a look.
Okay, so I'll let you ask.
Are you having any dyspnea, any shortness of breath, or do you find yourself struggling to breathe at any point?
Yeah, actually, I do get a bit short of breath, especially when I'm trying to keep up with the students or walking up the stairs at school. It feels like I just can't get enough air in, which is pretty frustrating for someone who used to be quite active.
Okay. So what is interesting here is if we also look at the...
Is it really dangerous, doctor? I mean, I don't take any pills or anything. I've never even had to take something like aspirin regularly. So all this hospital stuff is very new to me.
Yeah, okay, so maybe I will take this advantage that accidentally you said, okay, so we can also see that he's mentioning some drugs, right?
Yeah, so he said that he's never had to take something like aspirin regularly, so pretty much everything is very new to him. So over here, what I would also think about is he's saying that it's not corresponding to any single coronary artery territory. What we can do is also do a physical examination. So let's see. how the physical examination works. Essentially, we ask for specific findings that we're interested in looking at, and then the AI tells us of the findings. So for example, check for signs of skin paleness, cyanosis of the mouth, or any bluish coloring of the nail bed.
The skin is of normal color, with no evidence of pallor or cyanosis of the lips or nail beds.
Upon auscultation, what are the findings for the heart and the lungs? Do we hear any murmurs or any crackles?
Cardiac auscultation reveals a regular bradycardia of 48 beats per minute, with no murmurs, clicks, or gallops. The lungs are clear to auscultation bilaterally, with no crackles, wheezes, or rhonchi.
I think we should also just, check if there's any jugular venous distension, ankle edema, or any right upper quadrant pain.
Yeah. Inspect for jugular venous distension, any edema, lower limb edema, and also check peripheral pulses.
Great.
Jugular venous pressure is not elevated, and there is no peripheral edema in the lower extremities. Peripheral pulses are palpable, regular, and slow, symmetric in both upper and lower limbs.
Great. So this is a good, representation of how the physical examination works. And now I think we can show how we can order some X-rays and see its findings as well. So we go for imaging and we go for X-rays here. So here we have multiple different options. So let's do a chest X-ray as a starter.
That seems like the best option for this patient. Yeah.
And here we would normally want to find some sort of effusion or some pulmonary edema. But what we can see is bilateral hilar lymphadenopathy. What do you think is there something clicking in your mind?
That's actually pretty interesting because this isn't something you would normally see, but this can divert our attention to some different possibilities. So lymphadenopathy would indicate some kind of inflammation, maybe some kind of systemic inflammation. I know that bilateral hilar lymphadenopathy is associated with TB. Okay. So I could push my attention towards
Thomas,
that.
just for us, that we are on medical background, what TB is?
Yeah, TB.
TB is tuberculosis.
Okay.
Yeah.
Okay.
Yeah.
But I think that he would have a lot more signs. I think there would be a lot more lung findings. What true. I'm thinking of is sarcoidosis.
That's also a very good possibility. Yeah.
So, guys, just sorry for interrupting you. We got some first question from audience.
Sure.
Okay, I see. Nazir. Hello, Nazir. Thank you for joining us. So, just read his comment. It was interesting the way you both collaborated on the consultation and diagnosis, especially on the tools and results. Thank you. Do you think it's valuable to use the virtual patient for training in groups too?
Yes, that is precisely what we're trying to show here. I think it's very fun. I try it out with my friends as well. It's very fun to sit together and to solve a case because it helps us challenge each other's thought processes as well and also improves us. So it's been really helpful, and I think especially in classes, it would be great.
Okay, so this is your way of preparation, even non-digital world, just joining together and going through all the material.
I think the great thing is, even if we're both wrong, at the end during the evaluation, the AI will use the nice guidelines, and it will give us the correct diagnosis and where we made mistakes. So even if we both get it wrong, we can be sure that we'll have the correct answer at the end.
So do you need more information, or are you already able to guess the diagnosis?
Well, in real clinical practice, I would first do a complete examination, because if I'm thinking of sarcoidosis, which is essentially a chronic and systemic disease, which can affect multiple organs. So it's important to ask if there's any other problems in other organs. Yeah. So what I would do now is I would also try to ask him more questions if he's having problems anywhere else.
Yeah.
But yeah, sarcoidosis seems to be a good differential. And so what would you do next, Tom?
We can order some blood tests, which I think that's
Okay.
very important. In most patients, I think that would be
Okay.
an important thing. So let's order a complete blood count
Okay.
and with differential and maybe some metabolic panels as well, just to be sure.
Okay, so we can always get started with the basic or comprehensive metabolic panel.
Yeah.
So once again, we go to laboratory tests. So you said we would want to do a CBC.
Yeah.
So just to check if there's any blood abnormalities, so we can do it with differential.
Yeah.
And if you're suspecting sarcoidosis, we would ideally see an elevation in CRP because
yeah.
it's systemic inflammation. In chemistry and metabolism, I would do a comprehensive metabolic panel. It also gives us the liver function, maybe cardiac troponin as well.
We could go for this as well because we still haven't fully ruled out heart failure. So we can have a look here as well.
And then what else? We have thyroid panel, hepatic function panel.
Yeah.
We have serum lactate. Okay, great. So although hepatic function is already included in the comprehensive metabolic profile, we can still choose that. Sarcoidosis can also increase the calcium levels in the blood, can also predispose to calcium kidney stones.
Yeah.
So we can add serum calcium as well.
Yeah.
So let's order the selected diagnostics. So what do we see here? So we see multiple tables, and let's start all the way from the top. So complete blood count. Here we have the test names, the test results, and the reference ranges.
Yeah.
And we of whether it's okay or whether it's high or low.
Yeah.
So we can see over here that the blood count seems fine. The CRP is mildly elevated as expected, right? The comprehensive metabolic panel also seems okay. So the renal function is preserved. The liver function is also preserved. Cardiac troponin I is also below the threshold. So I don't think there's any myocardial infarction happening here.
Yeah.
The BNP seems to be okay. So now let's look at the hepatic functional panel, also normal, and even the calcium seems fine.
Yeah.
Okay. We looked at the kidneys, we didn't do an ultrasound though of the abdomen. Do you think we should do that?
We know that sarcoidosis can manifest in other areas of the body, so we could possibly do that.
Okay.
What else? We could, I know that a definitive test could be a biopsy, but that is quite invasive. And do you think that that's required in this situation?
Well, it's interesting because now this patient has a AV block, and this usually requires immediate intervention in the situation. So ideally, we would want to admit him, and we would want to then perform all of these further tests, which would take time to get the results for. And in that time, they can do some sort of a pacing. Maybe they can put a implantable cardioverter defibrillator as well. Because if he does have sarcoidosis, then he can be predisposed to ventricular tachycardia. We need a defibrillator at that point.
And we don't want it to result in a complete heart block, which would be catastrophic.
So in that situation, what we would do is we would also have to communicate with the patient and tell him that, look, this is what we think is happening. We have to do more tests. So let's try to communicate that with him. So we switch off the physical examination, and now I'm quite sure he would be curious to find out what's happening, right? So let's give him an explanation.
So we've performed some tests and done some analysis, and we believe that the possibility is sarcoidosis. But right now, what poses the biggest risk is your AV block. So for us to treat this, we will recommend admitting you for implantation of a pacemaker or a defibrillation device. So we do recommend that we admit you as soon as possible.
Okay, looking for his response. I'm really curious.
He's going to be shocked.
Pacemaker? That sounds like a major surgery. I had no idea it was that serious. I mean, I just came in because of some dizziness, and now you're talking about me needing a device in my heart?
Well, it's really surprised, right?
So what you can see here is a very good representation of how it could actually go in clinical scenarios as well. Because giving them such a huge amount of information can be very overwhelming to the patients. And they don't really know what sarcoidosis is. And also sarcoidosis is just one of our differentials. It may not even be that, right? So this AI also takes this into consideration, and it tells us whether we are being too direct, how our communication is, and so on. So now what I would do is, I have one important thing. We have to look for skin manifestations of sarcoidosis.
Yeah.
So we forgot to do that. Let's do it in the physical examination. Check for signs of erythema nodosum and calcinosis cutis.
There are no signs of erythema nodosum or calcinosis cutis on the skin.
Okay. Check for signs of lupus pernio. Okay, I think
He's already tired, you know.
yeah. So this, I think maybe you can refresh this.
Yeah, sometimes the connection is not so good. Okay.
All right. So let's continue. Okay. So what we can then say is we can probably tell him that, let's see. Okay, Mr. Martin. So we are going to do is we are going to try and we are going to keep you monitored. You'll be under safe care in the wards. And in this way, we can see if there's any impending problems with your heart. Right now, it's important that we stabilize you, that we support you. And then we try to find out what exactly could be causing these issues. Let's see if he calms down, you know. Okay, maybe there's something wrong with the connection.
Yeah, maybe just to double check it. Okay, here we are. Okay, so the operation is already turned. We got a demo effect, but anyway, I will just use this as a kind of technical pause. We got another comment from our guest here online. It's again Nazir. Hi, Nazir. So I will just read it for you. So would you say that our main benefits you have found working with virtual patients, and how would you quantify them to help other trainee doctors or even nurses and psychiatrists?
So, can you say the question once again?
Once again, yeah, because so I'm approaching our another laptop just to see the questions from audience.
So what would you say are the main benefits you have found working with virtual patients? Okay, and how would you quantify them to help other trainee doctors or even nurses and psychiatrists? So Tom, would you like to answer that first?
Yeah. So the main benefits that we found when working with virtual patients is that we can do it in a controlled environment, because in the hospital we don't have patients to test on. They're real patients with real problems that need real treatment. So us as trainee doctors or trainee medical students or trainee nurses, we need to be able to make mistakes. And it's very common to make mistakes. And it's much better that we make a mistake on a virtual patient, an AI, rather than a real patient. So through trial and error and through learning and through the feedback, we can make our responses better, we can reduce the amount of mistakes we make, and we can train ourselves to become better at communicating and to order the correct tests and to target our questioning and our diagnosis towards what we actually need to look for.
Yeah, I think the way I see this for nurses, for psychiatrists, and even for the trainee doctors is that AI and Medicteit included, it serves as an adjunct tool to this clinical bedside diagnosis. That is, it is an opportunity for doctors and for medical students as well to train, to practice, and then to utilize this kind of an experience in the actual practice. So it just helps streamline and to sort of fine-tune our experiences.
Great, so thank you. And okay, here's another questions from audience. So I will just want to read it for you. Is there a feature where you can present your case at the end in the way charting would be expected in hospital settings, where you include your differentials and get feedback on it?
Yeah. Okay. So is there a feature where you can present your case at the end in the way charting would be expected in a hospital setting, way you could include your differentials and can get feedback on it. Well, yes, actually, I think this would be good to show if we press the evaluate conversation. So Shreyan 6392, I think we can try that.
Yeah, we will try, because now it's time to answer the question
Yes.
by giving an example, right? Real example, right?
So let's just say, for the sake of showing, let's press evaluation and your diagnosis. So if I'm thinking, for example, sarcoidosis, I could say sarcoidosis.
So now we are using some international system, right?
Yeah, so this is the ICD codes. This is commonly used across many countries. Yes, there is some regional variation between these codes. These are codes that are used for insurance purposes and also for helping other doctors understand what is happening through a formalized system of nomenclature. So we are thinking of sarcoidosis.
Yeah, and I think it's very important because the question asks, can we present our differentials and get feedback? So if we submit our primary diagnosis, so we'll put
And then
sarcoidosis.
also, I would say maybe sarcoidosis of the cardiac sarcoidosis. Cardiac. Okay, I think we could.
Sarcoidosis of other uncombined sites, sarcoidosis unspecified.
Maybe we could use this as well.
Yeah. And we can submit.
But
But we'll
sarcoidosis
put-
of other uncombined sites. We can just, let's see, we can try choosing multiple.
Yeah.
Sarcoidosis of the lung with sarcoidosis of the lymph nodes, but he said, but the examination said only bilateral.
Yeah, there was no.
Yeah. So let's try this.
Okay.
I don't,
Okay, so now the system is going through all your communication, pick up your strengths, your weakness, and in very short time we will get some hopefully positive evaluation for you guys.
Hopefully. But we got a fair evaluation. So to answer the question, well, we can include our differentials in this, and also in other cases when we're trying to evaluate the conversation, we can include whether we should admit the patient or not, and our reasons for it as well. So for example, if we were to, I think we can show another case as well. So over here, we can essentially add our admission criteria, the reasons for admission, or whether it should just be outpatient. And that's usually seen in the evaluation conversation. Right now, we selected the diagnosis already, so we skip that.
So in that previous menu, there was an option to add the differential diagnosis and any further things we would perform. So that would be admitting the patient or prescribing some medication, or we could send the patient home if it's not too serious. So there was the option, like your question asked, to give a differential, and we can also explain our reasonings, and this will all be analyzed by the feedback, and we will have a really personalized report of what we did.
And that can be seen over here. So this tells us what the actual answer is, and it gives us some more information about what the patient has.
So what was the exact?
So it was actually cardiac sarcoidosis.
Okay, so you were right.
And usually if we are unable to find the exact term, we can also just go to Google and just quickly search up what's the ICD code, because there's so many codes. And then we can just type in the code over here. This is what usually as well. And we can see over here the view evaluation. I think this is one of the most interesting things for me in the platform, because when you press the evaluation, at first what we get is a basic scoring of how the whole process
You did
went.
well. Some out of 10. Congratulations.
Thank you. And it also shows us whether we try to address any critical safety findings. So we try to urgently identify the AV block, right? And then it tells us our diagnosis, what was incorrect, what was not incorrect. So here, because we did not submit it as cardiac sarcoidosis, it said it's incorrect. The student identified some clinical abnormalities, but the submitted final diagnosis was not matched.
Okay.
And
so I think we were a bit general with our diagnosis, but the AI expected a very specific diagnosis. So that's important for us. We should be very specific about the diagnosis.
Like in your real clinical settings, right?
Yeah.
Okay.
Exactly.
And here, performance by domain is a place where we can identify where you have problems with each scenario. So safety if we press show details, we get to see what are our strengths, what were the gaps, and how we can improve upon.
Yeah.
And then it's also supported by various guidelines, such as the ESC guidelines over here. And in the same way, let's see, historical and clinical coverage, we did a pretty decent job, I would say. It's not completely full-fledged, but for the sake of the under explanation. For clinical reasoning and management, well, again, the final diagnosis was not in match with what the AI wanted.
And I think what's really important is the clinical checklist. So it's clearly told us that we've missed some important points. So we did not ask about the medications and allergies when relevant. So that's a very important thing to ask. And the AI has flagged that we missed it. So for our next case, or when we practice in the future, we will make sure to ask these questions. They're very important. We didn't ask about some relevant cardiovascular risk factors or history. I don't know if we asked about family history.
Yeah, it is an interesting situation because what happens is in an actual scenario, if there is an AV block, then you would usually run immediately to finding a solution. And in that process, you should also be quick enough to ask for relevant risk factors.
Yeah.
So that is something that we can take away from this.
And I think if we were to do this on a real patient, this would be a very major error. So it's very important that it's flagged it for us on a virtual patient. Because in real life, this would not be, we would definitely have to make sure we ask.
You wouldn't pass the exam.
Yeah, we would not pass it, exactly.
Okay,
So,
exactly.
yeah.
So in this way, you can find out that even though, let's say, we are confident with some diagnosis, but there can be certain things that students and doctors can miss. And this is just because we are humans, we try our best, but we might miss certain points. And this platform will help us keep in touch with what is expected and what are the ideal, let's say, guidelines for each of these diseases to follow. So
Great. Just I'm coming back to our audience. There is another question. Hello, Nazir again. How do you see this training being incorporated throughout your medical training, and does it help with your exams?
So yes, well, we actually have an interesting feature that we are about to show very soon, where we incorporate our virtual patients and our practice with it, along with this new feature, and we are creating a holistic, website where students can be in this website and practice everything. So with patient cases, it helps us think on our feet. In Charles University, in the first faculty of medicine, we have oral exams. So the doctors can ask us, okay, so what do you think would be the signs of a patient with heart failure? Or what do you think the patient would usually complain? By knowing this specific case or by remembering this, we can kind of understand that, okay, if a patient with, for example, sarcoidosis came to the clinic, what is an example? What can I give? If I'm talking about some sort of infiltrative heart diseases, what can I talk about? So this gives us an opportunity to come up with immediate answers.
And there is another one. Again, from Nasser, thank you. You seem to value the consultation and performance by domain evaluation. You said you really like the checklist. How do you use the feedback? Can you follow up and improve?
Yeah. So Tom, would you like to?
Yeah, so the feedback is very crucial. So basically, when I read the feedback, I can acknowledge where I had my gaps in knowledge, where I might have not seen something when I should have, or where I missed some questions where I should have been asking more questions. And I'm pretty sure that after this, I can different patient or on a patient under the same cardiovascular specialty, and I can apply these apply the feedback that I've received to that patient, and I can possibly get a better score, and it can tell me that I didn't miss any of this. And more importantly, in actual clinical setting, I can remember that I missed all of this in my actual training so that I can apply it properly in a clinical setting.
Thank you, Thomas. Maybe, recently we added one interesting feature. We call it like personalization or education on demand. I'm interested. Do you use it? Because if we go up, if I'm not wrong, here is a kind of like continue learning from this case. So what is your opinion on that?
So yes, I had a very interesting story about this. Essentially, I was just trying out some new features. There was one about generalized anxiety disorder. And to be honest, it had been quite some time since I had, done my neurology rotations. So I just wanted to try this out, and I pressed learn from this case. And it gave me an opportunity to learn from flashcards, from questions. It would also generate some questions which is practical to the clinical scenarios. So they were so effective that even without consciously putting in the effort to learn, the way these questions are organized, it just makes you learn passively and you instill it in your mind. So for example, over here, we can say, let's generate some flashcards, right? So what this does is it generates the flashcards based on all the things that we missed. So like our viewer Nazir said, we can use this opportunity to improve on the domains where we lacked our skills in. So if we study the flashcards, for example,
Okay.
so we have a question: what is the classic cardiac MRI finding in a patient with suspected cardiac sarcoidosis? So let's say, if we are going to see maybe there's some hyper, dense lesions or something like that. Again, it depends at what stage we are in. I think the residents would be more specific in explaining, but I think maybe you could see it in a myocardial biopsy.
Yeah.
So let's see. Patchy mid-myocardial or epicardial gadolinium enhancement. So this again now reminds me that, okay, I had actually learned about gadolinium enhancement, which I seem to forget right now.
Like, what I really like about this is that our learning does not end when the feedback is given. There is further. We can create these flashcards, we can create questions, and we can come back to this. So these are all saved in our profile or your own personal profile. And whenever we study the topic again, we can come, look at the flashcards, or maybe practice the patient again. So be very knowledgeable and very competent to treat a patient with such a finding.
Yeah.
By the way, here you can also get get the feedback. So it was hard, good, easy for you, this question?
This was good, I would say.
Good, yeah?
Yes.
Not so hard, not so easy.
Not so hard,
Okay,
not so easy.
okay.
Why is it critical to check medication allergy history in a patient presenting with new onset heart block? So what do you think, Tom?
I mean, it could be some kind of interactions between medications, or it could be the patient is taking the wrong dosage of some kind of cardiac medications.
Yeah, like beta blockers,
yeah.
any of those, and also allergy history, because we need to know if he's allergic to any of the medications.
Yeah.
So let's see over here, beta blockers, calcium channel blockers.
Perfect.
Yeah.
Good job.
So let's say we put a good.
Okay, so this is very interesting. And maybe then I would, because I'm very surprised that we are so deep into one patient and we already spent more than almost 45 minutes, right?
Yes.
So thank you very much. Maybe you already mentioned about the new features. So now this will be kind of a secret guest. I would welcome our CTO, my co-founder Fabian, and he will show us the new features that he created for you. Thank you, Fabian.
Thank you.
Hello, Fabian.
Nice to meet you guys.
What's up, Fabian?
So I would like to show you our new feature we're working on in cooperation with students and to hopefully help improve the learning experience and make learning simpler and easier. We call it Notebook. You can find it here on the sidebar. Once you create a new notebook, it works kind of like ChatGPT. You get an interface where you can communicate with our agent, who can interact with all the different features across our entire platform. So the idea is, and I think this is really cool, you guys just showed our amazing virtual patient case. So what we can, for example, do is we can grab some information from the internet. Let me just do that quickly here. Okay, let me grab an article from Wikipedia. Okay, maybe you don't see that, but that's fine. I will go back to our patient. I'll paste the article there. I will send it to the agent, and the agent will go and browse the website. And once the agent returns, he will have all the information from the website available. So you can see that he outputted what he read on the Wikipedia article I gave him. Okay. And now we can, now that the agent has all this information, based on this information we've just given them, and this can be your learning materials or any sort of source of materials that you have. This can be presentations, exam questions, or whatever other material you have. You give it to the agent, and then you can ask him to generate anything you want. So for example, what I find really cool is you can just click a patient case here, and what the agent will do for us is he will generate a patient case based off of the information we've given him. So shortly, he should hopefully come back with a case where the patient has sepsis in some form. You will see what he says once he finishes.
And also it's, marks the border and we can open the patient case.
Yeah, and so the great thing also is now you can just click open and he will be straight in the session, and you can talk with the patient and diagnose him like was shown before, and ask and interact with him like you would with any other patient.
Yeah.
And another great thing we've just added is when you are starting a new session, you can, I guess this patient is under the specialization other. So you can now you can now have your own personal patients that you've created through the agent, and you can find them under personal here. And these are your patients that you've created from your materials according to your specification, and whatever you think is appropriate for your learning.
Okay. So I think this is an absolutely interesting, place to study as well, because what we can do is, let's say if I'm struggling with some topic, then I can just say, for example, create a case with, or let's say systemic sclerosis, right?
Yeah.
Systemic sclerosis. And I think it would do the same thing. So in this way, for almost any case, it would create a virtual case based on the already available cases. Or if there's a case specifically for systemic sclerosis, it would take it from a database and it would give you an opportunity to practice. And the same thing I think we can do with the MCQs, with the clinical skills, where it will ask us questions to practice in that specific topic.
Because I think a lot of students want to practice on something they've studied in that moment. So if they're studying a specific topic, being able to upload the notes, create these flashcards, then to consolidate all of your knowledge, do a patient case, I think that's a really great way for aspiring doctors and medical students, anyone. And if I'm not wrong, like you can upload PowerPoints, notes, and just links to like Wikipedia articles and everything.
You can bring all your information from school with you. You can put it to the agent, and then the agent will give you the answers. It is also quite good because even if we don't, for example, cover your specific our existing patients, you can just bring your own data and make your own patient, and it will get placed, for example, under the other section or somewhere, and that way you can get around the limitations. And like Sagar mentioned, you can also make MCQs here. So let me just do that here. We didn't really show that much before. So again, now the patient takes all the previous context we've given him, and he actually fails, but under normal circumstances, he would generate the questions, which would then be available here. So we've actually generated some questions for the case before. So we can open them, and now we see, these are in Italian. Okay, well, we just generated these ones. He tried again and succeeded. So here we can see that he generated the multi-choice questions for sepsis.
So we can say, like, for example, this, and then you press next, it gives you the correct or the wrong option. And in this way, we can essentially, for example, sequential organ failure assessment is the answer for this. And in this way, we can keep going on with the MCQ cases as well.
Yes, so this is the way we are really trying to connect the platform together and make the learning really seamless and easy for students, so they can bring their own materials, create whatever materials they want, whatever features they want to use, and learn hopefully fast and easily.
I think that ties in really well with the community and leaderboard features, because I know that sometimes when I'm doing some of my like virtual patients, I quickly have a look at the leaderboard and see how many patients Sagar has done and see who is currently winning. So I think this just brings a lot of collaboration and a lot of like good vibes among students to work together.
And you also introduced the work groups as well. Could you speak more about that?
Yes, so we're trying to make the platform community oriented, and we do that with multiple different features. So I think it all starts kind of with a community sort of like Reddit, where people can post their cases and discuss how they've done, and if there's any problems or they're unsure about anything, they can discuss with other students what the problem is, and they can all expect the same cases. So I think this is really cool, and we're working on building that. In addition to that, we have released a leaderboard where you can compete with other students. And this really hopefully is going to increase the retention that people have with the platform, because everybody wants to win. And then once each month end, somebody on the leaderboard, the first 3 get medals, which are then displayed in the community. So when you then make posts, others will see that you really worked hard to get there. And Sagar mentioned groups. So this is mostly for institutions or groups of friends. You can make a group within our system, and then you can all be a part of the same group where you can get statistics on how you perform together, and you can see how the evaluations across your entire group are. And it's very useful, for example, for like classes.
Yeah, I think that's a great feature as well, because especially in medicine, it gets so tiring to just study and study. Sometimes, our friends might have different pace in learning, but over here we can all work together. We can see who's doing which kind of cases, and we'll have a common case to discuss about. And I think that sort of gets everyone more motivated, because we also know our peers are doing the same thing. Exactly. So it's a great feature where we can learn together, where you have one website that is allowing you to maximize your resources, practice cases, do MCQs, and in this way, keep repeating the information again and again until you get a practice naturally.
Yeah. Awesome.
So yeah, that's something.
Okay, guys. So thank you very much. We are almost approaching to the end, so we should just only see if there are more questions from the audience. And if you do, please send us just now. And now I would like to take this opportunity to invite you for the next webinar. This time I would invite really expert, cardiology or professor from neurology, and we can see our platform from their direction, from their view. It will be a little bit different, because those professors are really questioning you in the exams, for example, right?
Yes.
And the last one, thank you, Nazir. I really like the community capability for crowdsourcing running, especially due to the specialism. It would be good to see lead contributors or experts highlighted. It's a good one, right?
Yes, definitely. I think it is a good opportunity where doctors can also input their cases, and they can sort of build a database where a lot of students can practice a variety of different cases. So I think that's definitely a good point as well.
Yeah.
Lovely. So thanks again for joining. Please subscribe our channel, because another webinars are coming. And before really leaving, the last comment, big thank for the demo. Really enjoy consultative collaborative approach. Thank you very much. Thank you very much. Looking forward to seeing you probably in 1 month. Thank you for joining. Bye-bye.
Bye.
Bye.